Shalom, welcome to the Jewish View. My name is Rabbi Nachman Simon with the Chabados of Delmar, and we have a very special guest with us today, Dr. Joshua Zamer Medical Director for Addiction Medicine at the Saratoga Community Health Center. They got all that right, very good. Well, Doctor, welcome to the Jewish View. That's the main thing. You know, today, addiction is a major issue. It probably was an issue a long time ago, but it's really getting into headlines, and I know the president has given billions of dollars to have it cured, so it's really on the frontline pages over here. So maybe just start off and saying how bad is the issue, you know?
Well, yeah, I think addiction's sort of always been there through human history. The opioid crisis has gotten a lot of headlines recently, especially overdose deaths with some very young people.
Yeah.
With heroin that's often laced with fentanyl, and people are getting sort of higher doses than they think they're getting of opiates. And unfortunately, a lot of young people have died, and that's sort of caught the headlines.
You know, it's a shame because, you know, I mean, as a rabbi, of course, people come to us for troubles, and, you know, we're limited because, I mean, we're not doctors for number one, so surely not giving medicine, but is there any cure for I mean, someone comes to you and they say, listen, I'm hooked on heroin. First of all, they have to come to you, I guess. That's number one. You know, so that's a big issue. I mean, some people don't want to get help, or, you know, you can't help somebody who doesn't want to get help. That's always.
That's true.
But what would happen if someone came to you for, let's say, for example, that kind of addiction? There's medicine, psychology.
Yeah, I mean, that's a really good point, that they sort of have to want to do it. So if people come sort of dragged by the parent or the friend or the teacher or another loved one, it's almost sure to fail. It has to be sort of self-driven, a person really ready for change. And then we try to offer a comprehensive program that includes medication, where we essentially give a medicine that's almost like a mild opioid, not enough to get you high, but enough so you're not sick. And then we also do counseling to sort of get at the root of the behavior and a lot of the emotional pain that sort of led to the addiction.
That's an inpatient where you are, or
I
does
do.
people come in?
In Saratoga, I'm doing all outpatient, or a non-intensive outpatient program. I also do some part-time work at St. Peter's at the inpatient detox. So I do sort of both ends of it.
Is there enough space for some people? Tell me there just isn't even enough space for all these addictions. I mean, how many beds there are?
Yeah, that's a good point. One thing that's lacking is inpatient rehab. That's when you go for usually 2 to 4 weeks of you know, almost like a hospital setting, where you get out of your environment and you can really focus on your sobriety. We're always fighting for more inpatient rehab beds. In addition to more outpatient access as well to programs such as ours. We probably need more of that.
That's interesting, but you know, people do come for help. I mean, there is enough people that, I mean, how widespread is the addiction, do you think? I get, like, I would think you're only getting a percentage of people who really are sick, because they have to come to you for help.
Yeah, I mean, it's addictions. It's big. If you look at all addictions, you know, if you look at alcohol, cigarettes, and all the other drugs, it's a pretty big slice compared to other chronic diseases. So it is a major problem in the country. It's often, you know, access, sort of getting into a program. You know, there are programs out there, but sort of getting a foot in the door is always tough for people. Making that step, realizing they have a problem, and almost making that brave step to admit they need help and to go for the help.
People can't go cold turkey. I have, you know, one of my 10 jobs is I do prison visitation. Yeah. And one person, I just remember, he says it's the most horrible thing in the world, where they're not going to give you drugs in jail. Yeah. And he says it was tremendously horrible, but then he did kick it at the end. Yeah. But that wouldn't be a good advice, just to stop it.
No, that can be you know, incredibly painful. Thankfully, a lot of jails and prisons are sort of changing their philosophy around this. So I know Albany County Jail is now offering the medication-assisted treatment, the Suboxone, to help people sort of gently come off and even maintain on it, so that they don't go through the painful withdrawal that you're talking about. Because going, cold turkey, that can be really stressful on the person, and
Yeah, that's
almost inhumane.
Yeah, that's what people actually
Yeah.
tell me, but, we had Albany County Sheriff Craig Apple
Yeah.
on the television show, and he once said, the rabbi says, and he said that the addiction's a big problem. He says, you want me to fill up the jail with addicts, I'll fill it up all night, but it's
Right.
not gonna really help just to incarcerate these people. They do need help, and he's very liberal, I thought, in that sense, where,
Yeah.
usually, lock them up,
Right.
these addicts and get them off the street, but it's a new kind of idea where,
Yeah.
people do need help. I'd say the least they need help if they're in jail.
Yeah, I mean, sort of the old model that we've attacked addiction with has been like the shame and guilt model, that you're weak, you're weak-willed, that you're a weak person, and the sort of criminal model that, low-level use, sort of nonviolent use, that's a criminal, we're gonna throw people in jail. Both of those have failed. So I think the way forward is sort of a medical disease model, where we look at addiction not unlike cancer, heart disease, diabetes, asthma, as a chronic disease of the brain that can be treated with medication and counseling, and not sort of something to be stigmatized and judged. And I think that's the proper way forward. And sometimes the worst place for someone battling addiction is in jail or prison.
They're not gonna get that much help, I can tell you that from visiting the inmates. Is there, like, even before, let's say, youngsters, people are saying they're using marijuana young
Mhm.
anyway, but could they be recognized? Like you say, maybe people have psychological problems, and saying, well, that's a candidate, you can't totally pin them, but
Yeah.
saying, hey, that person's gonna be on drugs, because you see they're depressed in school,
Yeah.
teenagers, or.
Yeah, I mean, there's a huge crossover between mental health and addiction. So the patients I see, 70–80% have concomitant mental health issues.
Would they try to cure themselves? Is that what they're trying to do, or just run
Well-
away from their problems, like they're so depressed?
Yeah,
so they'll
there-
float away or something?
There's a bit of that. There's a bit of, like we said earlier, this sort of chronic emotional pain. A lot of times people struggling with addiction had some sort of trauma in their life, whether that was neglect or abuse or sexual abuse, or a parent that was struggling with an addiction or a mental health problem, or a parent that went away to prison, something very traumatic that left them sort of with this emotional pain, and the only way to soothe it that they found has been drugs or alcohol. So, we know when you look at risk and young people, we know that if you suffer from addiction, your offspring have about a 7 times higher chance of developing addiction.
Yeah, again, for my, again, I'm not as experienced as you to say the least, but, I do deal with a lot of people, and a person said, yeah, my father used the drugs.
Yeah.
And I guess, although you're saying that's typical. One of the things is a gateway drug is marijuana. Now, I don't know how you feel, but I'll tell you, usually I don't take a stand in politics, because I have Democrats and Republicans, and like I say, and liberals and conservatives, and, it's not my rabbinical job to say, should you pay more taxes or not. But one thing I'm totally against is this marijuana. I just feel it's ruining people, or is it a gateway drug? I guess you're the professional on that. You see marijuana as a stepping stone, or, again, hand in hand with that, I've discussed it with many people, and they say, well, Rabbi, you want to ban marijuana, you should ban alcohol, because that's also,
Yeah.
and that's totally legal. Well, I guess you have to be
Yeah.
21 years old, but totally legal. And there's so many problems with alcoholism. Why don't you say, concern yourself with banning? We would have to have Kiddush over here Friday night. Yeah, but, there is actually a rabbi, and he's very famous. I don't know if it's Dr. Twersky, and he saw so many problems.
Yeah.
He says he banned the alcohol altogether. He says you can make Kiddush
Yeah.
Friday night on
Grape
grape
juice,
juice.
yeah.
And I haven't heard anybody take up on that, to say the least, but he's an advocate, but,
Yeah.
you know.
That's, look, on the one side, cigarettes and alcohol kill a lot more people than marijuana ever did. So there's a hypocrisy there. Now, that said, marijuana gets a lot of good press, that it's sort of the cure-all for everything, whether it's pain or nausea or anxiety. There's not a lot of good evidence in actual practice. We find that people taking it for anxiety, it often makes them more anxious. People taking it for nausea, it gives them nausea and vomiting. It may have some role in people with a cancer diagnosis or with a terminal illness, glaucoma. It's had some success with children with epilepsy. So I think there may be a role, but we need more research. Right now, we don't have enough data. As far as a gateway drug, not everyone who uses marijuana is going to go on to hardcore drug use. That said, most people don't start their use with IV heroin. They usually started at a young age with alcohol or cigarettes or marijuana. So does that answer the question?
I see that. You can't pin exactly everything wrong with them. And people answer me back that, marijuana is a cure. Well, this is medicine also. My sister's a doctor, and she says, I give out steroids, because she's an oncologist, a cancer doctor, every day. But, for the right people, steroids are good.
Sure.
But if you're a normal person or an athlete, and they'll throw you out of the leagues
Sure.
if they see that you're using steroids, it's wrong. So fine, if it's a medicine, if they can prove that it's a good medicine, fine. But a regular teenager in the street over here, why should they be using these drugs?
And even the people that are the biggest proponents of legalization of marijuana or medical marijuana, they will admit that you really don't want anyone using it under 21 or maybe even 25, because we know there's this vulnerable period in adolescence that if you start with drugs and alcohol then and you have a problem then, your risk of a problem later on is as high as 80 or 90%. But people who, if they have a problem later on in their 20s, the risk of having a lifetime problem is much, much less. So anything we can do to delay the onset of use of drugs or alcohol is huge because of that vulnerable period where the brain's still developing.
Yeah, but that's what they have statistics on. Again, you know more than me, but I just see that they have preteens and teenagers, alcohol and marijuana.
That's a huge risk. If you start, the brain's still developing in adolescence and even into the early 20s. So use during that sort of vulnerable time is really, really dangerous. That's one of the things we try to educate about, that even someone who thinks that marijuana is harmless, you can't say that for a teenager or an adolescent. We know it does, damage to the brain and can lead to problems later on.
It's interesting. I mentioned the kiddish, we are on the Jewish view, and used to be, the Jewish people don't worry about alcohol, and a doctor once said it to somebody, says, I'm an alcoholic, says, you're Jewish, don't worry about it.
Yeah.
But I mean, again, maybe you need the whole survey, but do you think it affects the Jewish community as much as anybody? I mean,
absolutely. It does not discriminate whether what color you are, your religion, male, female, whether you're rich or poor. We see this disease affecting, all segments of society.
That's interesting.
Unfortunately, that's one of the things that got the opioid epidemic into the headlines. People have been struggling with, heroin addiction for decades, but it tended to affect poor people. As soon as middle-class kids started getting into trouble and dying, that became a big problem. So we need to look at that as well. But it does not discriminate.
Yeah, that's what I think, because people come to me, of course, more Jewish people, or everybody who's Jewish comes to me. But, I was always pushing the Jewish community. I've been around for so many years, and I says, well, I'd like to see some Jewish, action. And that's what they pushed me off. Oh, it doesn't affect the Jewish, or they didn't want to give the Jewish community a bad name, while we have addicts running around. But finally, that's also a turning point, like you say, and even in the world, like, hey, addiction's a major, major issue, and Jewish community is finally boned up to saying, hey, it affects Jewish people, and we got to get the help for them also. That's an important point. Where, you say, I was saying about getting them early. Do you go out and educate people, or, saying kind of what I'm saying? What I'm asking you, hey, you're a teenager, think about it, your brain, it's not just, oh, let's have fun and, go to the amusement park and have fun and maybe we'll just get drunk and,
Right.
marijuana, maybe they're immature and they probably think that way, but, do you go out and educate these people or?
Yeah, I mean, we're trying to target younger and younger, because once they're into middle school, even that young, it's almost too late. You really got to target them in elementary school to get that message out there that, starting drugs or alcohol, at a young age can really do damage to your brain. So trying to get that message, it's almost like you can't be too young in elementary school to get that message out there. One program I've been involved with is just a cigarette cessation program where we target, like third and fourth graders before they even get into middle school about the dangers
Really?
Of cigarettes. Yeah.
It's really a shame. My heart feels for these, just a little kid that, or even middle school.
Sure.
Can't say that the middle school kid, they think they're
Right.
mature.
Exactly.
But in any case, I know that they are, and it's just not the right thing, people ruin their lives, or like you say, they're stymied their, intellectual powers, or their
Sure.
emotional feelings for that. So that's an important thing that I'm glad you educate them. Well, that's what we're doing on the Jewish View here, of course. I'm just trying to get the word out,
Sure.
and, many non-Jews watch the Jewish View. I know on television out there are viewers, but they tell me, but even the Jewish community just get that out of their mind that we're immune, Jews aren't the
Right.
alcoholics and, the drunks,
Yeah.
the drunks are, the non-Jews, the Gentiles are
Not
the
true.
drunks.
I've had plenty of patients that were Jewish that have suffered from opioid addiction, alcohol addiction, other drug addiction. So it does not discriminate, and it affects Jewish people just as much as anyone else.
Yeah, that's an important point. Another thing, well, again, I'm the rabbi, not a doctor, but, I try to pitch, and I don't have the statistics for it, but if there's more faith in God, I mean, you did say it doesn't, discriminate in religion, but some people are, I don't know, maybe I'm just trying to be Pollyannish, think that if you have faith in, in God, then maybe you would, you wouldn't be addicted. I know it's not 100%, but.
No, a lot of people, they find success in sobriety through religion, because essentially when you're deep into addiction, the drug or alcohol or behavior, something like gambling, it takes over your life. It is your God. So you're left with this sort of emotional emptiness that you're looking to fill, like a hole in your soul. And a lot of people do find that through religion,
Yeah.
and it can be very powerful.
I have actually an interesting story. This is many years ago. Dr. Twersky, Abraham Twersky, he's a big person with the alcoholism. I'm a psychiatrist. And he came to talk. It was a little funny because I thought, oh, he's a rabbi also with very, long beard, bigger than mine. And, I thought, oh, okay, I'll listen to a rabbi. I know he's a doctor, rabbi doctor. But he really talked only about alcoholism because that's his profession. And then he went to the Schenectady. And I have a few stories. And I called him. He was there for a whole weekend. The Schenectady Jewish Community Center brought him out. And they said that there was one session. He's talking to professionals. So again, like I'm talking to you, I'm learning and, just trying to tune myself up also, always learning. And I says, well, I called them up. I says, I'd like to come on. And they started laughing at me. And I said, well, I'm a rabbi. I know I'm not a quote unquote professional. Oh, rabbi, she says, I'm not laughing at you. It's just the people that are professionals that are alcoholics. It's not, I thought they were teaching, I'm ready to be taught, how to deal with this.
Sure.
That's why I'm a little bit asking you. I learned myself. My viewers, I'm sure, will be learning, but I'd like to learn also about all these things. And then afterwards, another story, he came over, he was walking around, and I thought it was Jewish, so I brought up people from our Chabad, I says, hey, listen, Dr. Twersky, rabbi, he's a big person. He really is. Very big rabbinical family. And let's go to him. So we buttoned a hold of him. He came around to us. And again, this comes to the point that you were making, that, the Alcoholics is Anonymous is really very God-driven.
Yeah, higher power.
Higher power. So he was pitching that too. So, it was a question I had also that, I says, you know, it's very nice that if someone does believe and it would help them, fine. What if someone comes over to you and says, I don't believe in God? So I'm 6 foot tall and he's a short guy, but if these powerful people, they're short and they make you feel like you're 2 feet tall. And I mean, he's a powerful person. And he looked at me, he says, you know, when I tell someone if they don't believe in God, I said, no, what? He says, oh, you do believe in God, but you think it's you. And he said, I saw he wrote it up in a book afterwards, but he told me that personally. But again, it's like you say, that reminded me of what you said. You know, they're gambling. That's, you know, they believe that's their whole life. You know, to me, it's Judaism. I got to learn. You know, it's a mitzvah here and a mitzvah there, and you got to do mitzvahs all over the place. And there, it's like they're always thinking of gambling. So you're right. If you can,
it becomes essentially the drug, alcohol, or behavior. Like, you know, it becomes your God. Yeah. And when you take it away, what's going to fill that hole, that spiritual hole? So again, it can be very, very powerful.
Yeah, I know one person actually, so many years ago, but he says this is really not addiction, but it's a cult, which is like an addiction. He says you cannot just take a person out of a cult, you have to back them up. That's reminding me what you said also now, that you can't just say, get out of there. You know, but that was their life. You can't leave a person with nothing.
Right.
So, you know, they have to have something to that they look forward to, or something like a higher power or whatever to gain themselves. You think that you know? I mean, you don't work with thousands and millions of people, but is the addiction problem being cured a little bit? I mean, I know there's federal money now. I mean, that's what we said at the beginning, that people are being aware of it, and awareness is obviously the first thing. If people there's nothing there, people aren't going to get help, and everything costs money, of course.
Well, I think that the ship is turning slowly as attitudes change. Again, the more and more we recognize this as a brain disease and a chronic illness rather than a criminal problem or a character flaw or some sort of weak will, the more we focus on that, I think the better we do. So I think slowly that ship is turning. We have a lot of work to do. The opioid crisis gets a lot of attention, but if you look at the numbers, alcohol actually kills twice as many people per year. But you don't hear that. It's sort of not sexy on the news. All we hear is opiates, opiates, opiates. But so there's a range of addiction. It's not just opiates. There's benzodiazepines, cocaine, methamphetamine, alcohol, cigarettes, and of course opioids. So and marijuana is actually a very real addiction. So there's a lot of stuff out there, but I think we're sort of fighting the good fight, and I think we're making a difference, trying to change attitudes. And
yeah, well, I think the education, just the awareness that it's, just it gets out there. Hey, there's problems. And the thing, like I say, I don't know what people think. It's cute and it's nice. Everybody else is doing it. Yeah. I mean, cigarettes. Maybe it's the cigarette taxes, but I think cigarettes have gone down. The usage of cigarettes is.
Yeah. Although now there's this explosion of the electronic cigarettes with younger people.
Is it a real problem, you think? I know it's in the headlines.
Drive by a high school or middle school, every kid's on the vape.
And it's legal?
Well, that's a good question. A lot of states are tamping down because there's been all these respiratory illnesses and even deaths from the electronic cigarettes.
Smoking? I don't even know myself. What is it? I mean,
it's like a liquid sort of nicotine substitute that they're vaping in like almost like a vaporizer. But it's not.
What does it do for them?
It gives them cigarette. It gives them nicotine. It gives you nicotine.
Gives them a
but you're inhaling it, and all these chemicals are getting in your lungs that no one. It's a fairly new thing, so we're just learning sort of how dangerous this is. The country of India banned vaping completely, made it completely illegal in the entire country, based on all the stuff that's coming out.
But America, they started up on that. It's a newer thing, isn't it?
Yes, but we're realizing, I think that's going to be down the road. There's going to be more, I think, states banning electronic cigarettes and vaping.
Yeah, so there's always something coming up, I guess. It's always.
I think the state of Massachusetts banned all vaping, marijuana and tobacco for 4 months till they can get a better handle on exactly what's going on and sort of how dangerous this is.
how do you vape marijuana? It's like it's a
Similar,
leaf.
you,
It's
they
the
put it like in an
chemicals?
oil,
Really?
and it's like a little pen. That's the problem with some of these look like your hard drive on your computer.
Yeah.
That kids are using to vape,
Like a
and their
flash
parents,
drive,
yeah, they
it's
think
a
it's a
small
flash
thing.
drive, and it's actually either nicotine or marijuana, a little device. So
And
that
then
can be
you-
tricky too.
And you smoke it, or you?
You essentially smoke it. You're getting a vapor, a water
Yeah.
vapor in your lungs.
It's a shame over here. I mean, I just feel bad that people need that, like you say, a substitute for,
Yeah.
to always get something in a
Yeah.
high or something like that. I don't know if it's maybe social pressure, but again, the government, I mean, cigarettes, like I kind of said, that I think the taxes, just simple economics, $10 for a pack of cigarettes.
Yes.
And
Cigarette smoking's down.
Yeah.
Definitely.
Because you think of the taxes, or
I think
just the education
public
also?
education, that the money's a big thing. $10 for a pack of cigarettes, people think twice.
Yeah, well, there's a lot of education going on, also
Yeah.
billboards and.
And there's less, you can smoke in less, you can't smoke on the plane, you can't smoke in a restaurant. Everywhere you look at, smoking's banned, so there's almost like nowhere to smoke anymore.
So, yeah, that's what I'm saying, well, the outside force is not just saying don't do it. But,
Yeah.
just, you make it illegal, or,
And education, knowing, I think, decades ago, we didn't realize how dangerous, cigarettes really are.
yeah, they thought it was even good for you, I think. That's
Right,
what-
doctors are smoking in their office,
Yeah.
people are smoking on planes, but, yeah, the tide has definitely turned on that.
Well, I mean, it's interesting, though, on the other hand, that, I mean, I'm thinking like alcohol, but, I mean, you could say sugar is no good for you. I mean, there is gonna be a limit.
That's a good point. I mean, again, we can talk about behavioral addictions. Gambling's a definitive one. People will, the heart of addiction is use, continued use despite negative consequences. And almost like this lack of judgment and the drug or behavior taking over your life. So someone who's gambling, there's no drug involved, right? But they get this high and they completely ruin their lives, and it completely takes over their lives. They continue to do it despite the fact that you can't win. You're never going to win in a casino, but the behavior persists. So it's a
Just
weird
that
thing
one
in
out
the
of a
brain.
million, me, the lottery, one out of
Yeah.
a million, you can win.
But most
Well,
people,
maybe,
most people are losing.
Yeah, for sure.
Um,
The
so-
casinos wouldn't be in business.
But eating addiction is
Yeah, right.
another thing we're starting to really look at. People who, again, through something we think happened in their childhood, have this sort of emotional pain and soothe it through eating temporarily. And they get, almost like a little high, and you develop tolerance, so you need more and more. Or one jelly donut made you feel
Yeah.
good last week, this week you need 2 and then 4. And now all of a sudden you've developed obesity and health problems, and you're eating to deal with your emotional pain. So we're learning that there may be something to that food addiction.
Yeah, it's a shame over here. Again, I mean, I guess, being as a rabbi, I just say there's a spiritual void, that feeling.
Absolutely.
But it's not absolute, because, I mean, people do smoke and they overeat and
Yeah.
religious. You can't just pin, like I say, 100% on that. But
Yeah.
I think it would, listen, I mean, a rabbi, that's what I pitch over here.
Yeah.
I don't pitch medicine. I just say, hey, you get into God and, have a fulfilled life and doing the mitzvahs and
Well-
get a high on prayer,
Absolutely. That's sort of, part of what we try to teach people, that not to look for external things, to try to turn in to, whether it's spirituality or religion, yoga, meditation, some way to turn into sort of a healthier answer rather than drugs or alcohol.
Sometimes I think it's like the breakdown of the family also. There's so many single
Sure.
parents, they say 50%, or,
Yeah.
so a person doesn't have a strong family background. I mean, again, they're looking for stability maybe in your life, or just
Sure.
things are so difficult, or just going
Yeah.
to float away, that kind of.
Yeah, sort of the harder, we think the more trauma or hardship in childhood, sort of your greater risk for addiction going forward.
Doctor, we're out of time, but it was so interesting talking to you, Dr. Joshua Zamer, Medical Director for addiction medicine at the Saratoga Community Health Center. You're doing God's work because you are. Well, listen, curing people. These people are, really need a lot of help. I know, and you're helping them out as best as you can. You can see in the rabbi business also, we're never 100%. You're going to be successful, but still, we're doing a good job. And thank you very much for educating our people, our viewership on the Jewish View. Thank you very
Sure,
much.
thanks for having me.